right, thank you for joining today. My name is Angelica Santiago. I'm the admissions officer for the online programs. And today we're going to be discussing our Master of Applied Science in Humanitarian Health. Joining me today will be Dr. Spiegel. He is our program director. Dr. Spiegel, would you mind introducing yourself to everyone?
Sure. Hello, everyone. My name is Paul Spiegel, and I'm a professor of practice at Johns Hopkins and a director of the Center for Humanitarian Health and a program director for the OPAL, the Masters of Applied Science in Humanitarian Health.
Thank you. And my name, as I said, is Angelica. I am the admissions officer. I've been working with Johns Hopkins for the past 4 years now. I have helped introduce some of our recent online programs, and I'm excited for the inaugural class start of this program, which will be starting September of this year. At this time, we'll go ahead and present a slide that shows the curriculum for the program. As you can see here, it's showing year 1 and year 2 of the program. And Dr. Spiegel will be giving us some quick details about the program itself, and then we will be opening up for question and answers. So feel free to, if you have immediate questions, feel free to start jotting them out in the chat box. And Dr. Spiegel, please give us some insight into the program.
Sure. Firstly, thanks everyone for who has joined. This is a new program, and we're actually quite excited because it's we do have a Master's of Public Health and a Master's of Public Health Science, Science and Public Health, but those are primarily in person. And what we're excited about here is to have a new course, the Masters of Applied Science, which is made for people who have had some experience and who want to continue working while also getting a degree from Johns Hopkins. Humanitarian health has obviously never been more important than it is now, and our goal is to make sure that students that graduate and the course is for conflict and natural disasters for global. It's not really meant for national, but rather issues in terms of, for example, what's happening in Bangladesh, what's happening in Syria, Venezuela. So it's an international course, and when you look at the year 1 and year 2, what we have been doing is we have some aspects that are core for all Masters of Applied Science who are taking this what's called OPAL, and so you'll see some of these, such as statistical number 4, year 1, semester 4, statistical concepts in public health. We have seminars in public health, so there are some that are core so that everyone has a core understanding of some biostats and some epidemiology. And then we move into courses that are very specific for humanitarian health. So for example, even as we speak today, I was working and finalizing all of the lectures and working on some of the quizzes for the public health and humanitarian emergencies. That's that's in year 1, semester 1, and it's a 4-credit course. And this is the idea of bringing all of the concepts, everything from protection, humanitarian law, to water sanitation, to health, nutrition, shelter, everything as a broad overview. And then we move into aspects such as disaster preparedness, water and sanitation, nutrition, health needs. And so we expand every term to go into more depth. Maybe that's just a broad overview. I have more to say, but I'd rather hear from you eventually when the presentation is over.
Thank you so much. We do have a few questions coming in. What I'd like to do while everyone is typing in their questions is give a quick overview of the updated 2018-2019 tuition and scholarship information for everyone's knowledge. I know that it looks like that's a few questions that are coming up. So I'd like to give an overview of that information, and then we will start taking questions. The 2018-2019 tuition is $1,128 per credit. Students, if you were able to see the presentation that was emailed out before, you'll see that we do have an OPAL Scholarship available. The OPAL Scholarship is a partial scholarship, but it is awarded to all students who are admitted to the program. So that particular scholarship will bring the tuition from $1,128 per credit down to $695 per credit. And over the 49 credits of the program in total, that will give you an opportunity to bring the tuition down overall to about $34,000. If you need additional financial aid information, you can type that into the chat box, and that is something that I can reach out to you personally about after the presentation. So again, that's just an overview of the tuition as well as the partial scholarship, which is available to all candidates who are admitted to the program. Early on question, which I think would be great for you to answer, Dr. Spiegel, is that we have a student interested in learning a little bit more about the integrative activity that they see in the last term of the program. Can you give us some insight into what that experience would look like?
Certainly. The idea of integrative activities is to try to coalesce what we have learned in a more lecture-like environment throughout the year. So what we will be doing, it's going to vary according to the students' interest. What we've learned through some of the other Masters of Applied Science programs in different themes or different sectors is that we need to start planning for the integrative activity in year one. So we would start by finding out what your specific interests are, where you are working now, if you are working, because many people may wish to use some of their experience and data, whether it be qualitative or quantitative, from where they're working. And then what we do is we work on a plan that will ultimately result in likely a paper, but it could be something else. Certainly it will be beyond a literature review, but that would be one of the components. And it also depends on, I think a lot of people ask about travel. We may be able to, in some circumstances, help with some travel depending on the projects that we're working on. But frankly, more and more we're finding that difficult for a variety of reasons. One is that we're working in areas such as Yemen or Syria where we're often not able to send students. But there are some areas that we can, and we can either help and we can try to connect with our contacts and different NGOs. So it may be travel and it may be more desk work depending on what you're looking for. And we will help you throughout try to structure this so that you ultimately have some sort of data, because data is important to use. And as I said, it may be qualitative or quantitative, following an interest that you have. And we'll also link it to what you're thinking of doing after this program, because a lot of these integrative activities may relate to future job prospects. I'm happy to speak more if there are more specifics on that. Over.
No, perfect. I think that was a very thorough answer. Thank you for the insight. Another question that I think would be great for you, Dr. Spiegel, is that students are wondering about prerequisites for the course. Who is an ideal candidate for this type of program?
Yeah, that's important, and we're slowly changing over time as we see the various applicants. What we would like is someone to have had experience either abroad in development or in humanitarian work. But we're also finding that now for some of the students that have applied and been accepted already, that they have experience more in domestic and are interested in expanding into international and global health. And so we have found, for example, we've received applications from numerous people that have had some experience abroad, but many have actually been working in either hurricanes or floods in the United States or in Canada or other countries, but do not have the global component. So that also is fine, as long as we recognize that this is not meant to be a domestic disaster program, but a broad global health program. We concentrate both on conflict and natural disasters, but we have a pretty strong emphasis on conflict. And it spans throughout everything. We're not, the focus is on health, but we mean public health in the broad sense. So we'll definitely look at security, political protection, wash and nutrition, and livelihoods. Over.
Thank you. I think the next question that came in is something that I can help go over. Students are curious about the program sequencing. As you can see, there is year 1 and year 2 of the program. The shortest amount of time that you can complete the program is 2 years. Students do have the opportunity, however, to expand if necessary based on other time commitments or financial commitments. The program can be extended to a maximum of 4 years. So the shortest amount of time to complete it is, as it's set here on the screen, a 2-year program. However, students do have flexibility within the program, and if needed to expand, can expand over 4 years. And as you can see with the program, it starts in September. So for this year, we will be starting September 4th. And the program it goes in 8 sessions. So as you see, you'll be taking 2 classes every 8 weeks. And that would be from September until May. Students will have the summer off from mid-May until end of August. And then classes will begin again in September for the 2nd year, and again run from September till May with 4 8-week sessions. Dr. Spiegel, could you give us some insight into the time commitment that students, if they are in the 2-year program, what type of weekly time commitment they could expect to contribute, and if there is any specific times that they have to be online?
Yeah, so all of these lectures are recorded. We record them specially for this Masters of Applied Science. And so during this time period, you can, let's say during this first semester of 8 weeks, you can watch these lectures whenever you would like. It's not during a specific time. I'm working on this concept, but likely every week or every 2 weeks, we haven't really decided, we'll have a quiz. We can talk about that, which is really just meant to make sure that you've understood the lecture components as well as some of the readings. And so for every lecture, there will also be readings that are posted. In terms of time commitment, it is intense because many of you may be used to 2 big semesters once a year. These are, at Hopkins, we have intense 8-week semesters. So you do have the opportunity, as I said, to be able to watch, unlike students who are doing it in person where you have to be at a class at a certain time, you have the flexibility. The other thing that I'm working on now as well is we do have what are called live talks. So everything will be recorded, and you can watch it when you want. Quizzes will be whenever you start. There'll be a limit of, let's say, 30 minutes or an hour, depending on the quiz, and then it'll be blocked. All quizzes and all this are open book. The live talks, though, will be also recorded. So if you can't make it, but that's an opportunity for you to speak with me or some of the other faculty. Usually it's in the evenings around between 6 and 7 Eastern Standard Time. And that works for many people across the globe, but not for everyone. So we will also look at that to see when it is appropriate according to where people are. And that's the time where we will be able to discuss, either just as we're doing now through through text, and or you can speak together openly. We also will have, so that's really the only time where we encourage people to be, where it's a very a strict timing. But as I said, everything will be recorded because we recognize not everyone can do that. Sorry.
Perfect. And for our students who are just joining, I know that you were able to give an introduction to yourself in the beginning, Dr. Spiegel, but would you mind, someone's asking for a little bit more insight into some of the experiences that you've had abroad, as well as some of the career opportunities for students who are looking to complete this program?
Sure. So my name is Paul Spiegel. I'm a professor and I direct the Center for Humanitarian Health, and I'm the program director for this Masters of Applied Science. I'm a physician epidemiologist from Canada. And I worked with Doctors Without Borders and Médecins du Monde, Doctors of the World in the field. And then eventually, actually, I did my Masters of Public Health at Johns Hopkins 20-something years ago. I went from there to Centers for Disease Control, where I worked in their emergency refugee branch. And then until I rejoined Johns Hopkins 2 years ago, the last 14 and a half years, I was the chief of public health and then a deputy director for the technical sections for the United Nations High Commissioner for Refugees, where we've been involved in all the major emergencies over the last decade. So that's my background, and many of the people speaking in the faculty are a mixture of people who have had field experience with NGOs and top researchers who have a lot of field experience doing research in the field. In terms of positions or jobs from these masters, we hope that it will be with international NGOs, possibly with the United Nations. We always, depending on where you are in your career, we always encourage people to start with NGOs in the field, non-governmental organizations, and don't jump to the United Nations because it's a very different area. Others may wish to work in government. I think it also, the big question is, and it's always a catch-22 is, well, I don't have experience. I've just finished a master's at Johns Hopkins in Humanitarian Health, but I don't have the experience in the field. So, and many of these jobs require minimum 1 or 2 years of experience in the field. And that is a problem. I mean, not a problem, but it's a challenge. And I think all students who do not have previous field experience have to deal with this. Often what we do, this is why this integrative activity is very important. We also try to, we have a group list, and even now we have a weekly newsletter that anyone can join from the center that gives positions and everything that's available. We often encourage people as well to do some internships that allow them to go in the field. That then what we found is that once just people get the opening to be in the field, the Masters of Applied Science and others that the faculty and what we've taught you usually allows you to continue on in an organization. But I think the hard part is once you finish this and you have the degree and you have the knowledge and the skills, it's just converting that into trying some field experience, because that's the next step that many NGOs or UN would like.
Thank you. I think that answered actually a few questions that came up here for us. Again, for those who are just joining, I did give some details about the financial information for the program with the tuition. I'll repeat it just so you're able to hear it now, and then we'll also send out a recording after the presentation is completed. But the 2018-2019 tuition is $1,128 per credit. There is a partial scholarship that is particular to this program. It is called the Opel Scholarship. And what it will do is that it will take off about $433 from each individual credit. So students will be left responsible for the remaining $695 per credit. Again, that is per credit, not per semester. So that is a per credit cost, and you pay for the number of credits you're taking as you take the course. Again, if there's more specific details around that scholarship, which it is, again, available to all students who are admitted, there is not a separate application. And the total for the entire tuition will be approximately $34,000 over the entire program. Again, paid individually per class as you are taking the classes. But if there are more particular questions, I'm happy to take them personally. My email is on this slide of the presentation, as well as my phone number, and I'm happy to talk a little bit more particulars about each individual situation and answer more person-specific questions. If you have any other questions, now would be a great time to add them in. Dr. Spiegel, as I'm going through the last questions, do you have any additional insights you'd like to share, or anything in particular you would like potential candidates to know about our program? Dr. Spiegel?
Sorry, I was on mute. Yes, a couple different, perhaps some broad issues that people may be interested in. Number one is that there is a quantitative component. It's meant to deal with some epidemiology and some of the biostatistics, because in this field, surveys and data are very important to be able to help us to address and really prioritize how we want to respond. But it is the level and the teaching is meant to understand that it's a generally mature audience who may not have a huge amount of quantitative background. So there's a lot of support for those courses, but I think it's hugely important. This is also meant to be able to, these courses, to be practical. And so while there will be a lot of lectures and you will be seeing PowerPoints and us speaking behind, we've also made sure that we've brought in certain YouTube videos. We will be doing recorded interviews with key people in the field from UNHCR, from the World Health Organization, that you'll be able to see. So we want to make it as interactive as possible. I see that there are around 16 or so people on already. I would be interested, if people don't have questions, for me to, if you can even just type in. I'm curious to know what you're doing now in terms of your backgrounds and why you are potentially and hopefully interested in humanitarian health.
Perfect. And I do know that you're quite interactive with our candidates. So there are some specific questions coming in that I'm going through them as they come in. And we can answer some broader questions now about the program. And I encourage everyone who has more specific questions based on their background to please email or please give me a call after the presentation. And I'm happy to field your additional questions and get them over to Dr. Spiegel if I cannot answer them myself, so that he can give us his input on your individual interests and your individual situations. Would that also be okay, Dr. Spiegel?
Of course. Absolutely.
Wonderful. I think we've been able to answer some of the broader questions. What I would like to do at this point is encourage everyone that our application deadline is coming up. We have been granted graciously an extension from our original deadline of July 1st. The extension has been granted until July 10th. So there is still plenty of time to work on your application for this upcoming September 4th class start, to be part of the inaugural class start for this program. In my office, we work very diligently and personally with students on their application process. So if you are interested, the application deadline is extended until July 10th, and your supporting documents do have a few additional weeks to arrive. I can explain that more in detail, and I would encourage you to please send me an email or give me a call after the presentation so I can speak with you personally and help you in your next steps. It's definitely been a pleasure speaking with you today, Dr. Spiegel, and thank you for so much wonderful insight into this amazing program.
Sure. No, I just want to thank the people on the call, and just to say that we want to make sure it's the right fit for everyone. So if you receive, I'm happy to answer any questions by email, and even if it requires a call, I can do that as well, since there's not too much time left, just to make sure that we get the right people and that we make sure that everyone gets all the information they need.
Perfect. I already have a few students that I will be sending you over information for, and the ones who have put in your particular information about your background, I definitely appreciate you sharing those details, and we will be in touch with you personally between myself and Dr. Spiegel to talk with you more in detail. At this point, I think I'd like to close off with asking you, Dr. Spiegel, when you think about the Master of Applied Science in Humanitarian Health and the design of this program, when students are looking at their different options in disaster management, in public health, why would you encourage them to apply to this program?
I would say the following. Number one is that we have a lot of experience in teaching this, and we, I think, are in a unique position because this is the first program that we're doing in humanitarian health that is online, that allows people to work in a day job while also doing this master's in humanitarian health. But we're taking advantage of the last 25 years or so that we have been teaching this, and so this is not something new. We've been doing it for a long time. So what we're doing, why we made this change, is both because we wanted to be able to attract people online who could work, and also more and more there are visa issues, and so we thought it would be a new way to be able, excuse me, to do this. But I think we, the faculty, are quite uniquely positioned in the world to be able to give this sort of course, given our background and our expertise in doing this. And ultimately, what we hope is that there are more and more crises around the world, so you definitely won't be out of a job if you go into this field. But more importantly, it's that we need, when I was at the United Nations, I saw there was a lack of people being sufficiently prepared to respond to how we need to respond in the future. And so this is one of the ways, amongst many others, that we're working at Hopkins to provide training and to provide experience for future humanitarians, because we're going to need them.
Thank you so much. One last word, our students, just for your knowledge, this program has its inaugural class start this September. This program starts one time per year, which will be starting September 4th of this year. So I'm excited to speak to more of you offline. Thank you so much for joining us today. Dr. Spiegel, thank you so much for such wonderful insight into the program.
Pleasure, and I look forward to meeting at least some of you September 4th. Take care, everyone.
Thank you. Everyone have a great day. Thank you. Bye-bye.
Bye-bye.